channel Nursing ADC. I hope you all are doing well. Today I am going to discuss about fetal skull. It is one of the important topic for nursing students. So why we are learning fetal skull in OBG or obstetrics? Why we are learning? We are learning fetal skull because it is one of the hardest portion of the fetus and it's very difficult to come through or pass through the birth canal. So if you are learning about the fetus skull and its part and landmark, it will be easy for you to understand the progress of the labor and presenting part of the fetus. So you know, like normally the head is a presenting part, and if you know about the fetus skull, you will be able to identify which part or which landmark of the head is there in the as a presenting part. That's why we are learning about fetus skull. Mainly in fetus skull, you have to learn about the three things. They are fetus skull bones and sutures and fontanelles. These are the three things you should understand when you are learning about the fetus skull. First is the fetus skull bones. So what are the fetus skull bones? Mainly there are 4 fetus skull bones. They are, first one is the frontal bones, and second one is 2 parietal bones and 1 occipital bone and 2 temporal bone. These are the 4 bones which is present in the fetus skull. So first is the frontal bone. What is frontal bone? It's a bone which is formed in the forehead. That is frontal bone. This frontal bone is divided into 2 halves and it will fuse at the age of 8 years of a child. Okay, until that it will be half. So that is a frontal bone. So frontal bone is a front portion or the forehead of the fetus is the frontal bone. Then next is a parietal bone. So parietal bone is a bone which is present in this area. Okay, this is one of the bone which is there in the large portion in fetus skull. So after the frontal bone, this area is a parietal bone. There will be 2 parietal bone, one in the right and one in the left. Okay, that is a parietal bone. And next is a occipital bone. Occipital bone is at the back of the fetus skull and it will join to the cervical bone or the shoulder bone. Okay, neck bone. Alright, so that is the occipital bone. And the last one is the temporal bone, which is present in this area of the skull of fetus and it is just above the ear. So that is the temporal bone. I hope you understood about the bones of the fetus skull. So mainly there are 4 types of bones present in the fetus skull. They are frontal bones and 2 parietal bones, occipital bone, and the 4th one is the 2 temporal bone. I hope you understood. Okay, we'll move on to the next topic. So what is the sutures? So we are going to discuss about sutures of fetus skull. So what is a suture? Sutures is a part where 2 bones are joining. That is known as a suture. Mainly fetus skull has 4 sutures. They are lamboid suture, sagittal suture, coronal suture, and frontal suture. So mainly 4 sutures are present. They are lamboid suture, sagittal suture, coronal suture, and the frontal suture. So first one is the lamboid suture. What is lamboid suture? It's a suture which present in between the occipital bone and the parietal bone. That means occipital is the bone which present in the back and parietal is in this area, this 2 parietal bone. So that sutures are the suture which present in between occipital and the 2 parietal bone is known as the lamboid suture. The next one is a sagittal suture. Sagittal suture is present in between 2 parietal bone. Next is the frontal suture. That's a suture which present in between 2 frontal bone. I told you frontal lobes is divided into 2 halves until the age of 8. And then last suture is a coronal suture. So what is a coronal suture? It's a suture which present in between the frontal lobe and the parietal lobe. I hope you understood the 4 sutures. So what are the 4 sutures? First suture is a lamboid suture. That's a suture which present in between occipital bone and 2 parietal bone. And next is the sagittal suture. That's a suture which present in between 2 parietal bone. And next is a frontal suture. That's a suture which present in between 2 frontal bones. And last one is a coronal suture. That's a suture which present in between the frontal bone and the parietal bone. Are you clear about that? We are going to discuss about the fontanelles of fetus skull. So mainly there are two fontanelles present. Well, before that I will say what is fontanelles. Fontanelles is nothing but it's a space which is forming when two or more sutures are joining together. That time there is a chance of forming a space. That space is known as a fontanelles. For the fetal skull there is two fontanelles are present. They are anterior fontanelles and the posterior fontanelles. These two fontanelles are covered by the thick skin so that the brain is protected securely. Okay, so there is no problem if there is fontanelles is present in the fetal skull. Also brain is protected by the thick layer of skin. So fetal skull consists of two fontanelles, as I mentioned before. That's the anterior fontanelles and the posterior fontanelles. Anterior is otherwise known as bregma and the posterior is known as the lambda. So how these anterior fontanelles are forming? This anterior is forming when frontal suture, coronal suture and the sagittal suture are joining together. Okay, when coronal suture, sagittal suture and frontal suture are joining together, that's the time this anterior fontanelle is forming. Okay, so what is frontal suture? That's a suture which present in between two frontal bone. So what is coronal suture? That's a suture which present in between the frontal bone and the parietal bone. What is sagittal suture? It's a suture which present in between two parietal bone. Is it clear? Yeah, so these three sutures are joining and there will be a space. That space will be diamond in shape. Okay, that diamond shaped fontanelles which present in the front of the fetal skull is known as the anterior fontanelle or bregma. This bregma is covered by thick layer of skin, and when it's a fetus, if we are touching into this bregma, we can feel the heartbeat of the fetus. And even after the newborns are born, when we are touching in that skin area, we can just feel some pulse. Okay, so that's all about anterior fontanelles. Next one is a posterior fontanelle. So how this posterior fontanelle is forming? Posterior fontanelle is triangle in shape. So that fontanelle is forming when which sutures? Lambdoid suture and the sagittal sutures are joining together. So what is lambdoid suture? That's a suture which is in between the occipital bone and the parietal bone. Sagittal sutures are the suture which present in between two parietal bone. So when these two sutures are joining together, that time a space is forming. That space is known as a posterior fontanelle, and that fontanelle is present in the back of the fetal skull, and that is triangle in shape. So that's all about fetal skull. So I hope you understood about the fetal skull. Summarize the topic. Fetal skull mainly consists of fetal skull bone, sutures and the fontanelles. So skull bones are included. 4 skull bones. They are frontal bones, 2 parietal bone, 2 temporal bone and the occipital bone. These are the 4 bones which present in the fetus. And next one is the sutures. Sutures also 4 sutures are present. They are sagittal suture, coronal suture, then lambdoid suture and the frontal suture. These are the 4 sutures which present in the fetal skull. And the last one is the fontanelles. Fontanelles there are 2 types of fontanelles. They are anterior and the posterior. So that's all about fetal skull. I hope you understood about this topic, and I'll come with another video in my next video. Bye bye. If you're new to my channel, please make sure to subscribe my channel and press the bell icon so that you will be notified with my new videos. Bye bye.